Today. My name is Dr. Ross, and I'm one of the chiropractors over at the World of Wellness. And we're going to kick off Wellness Week number 106 here. And today we are going to be talking about one of my favorite things to do, golf. And so basically, I'm just going to kind of tell you guys a little bit of my background. So I am a chiropractor. And one of my favorite things that I like doing with some patients outside of the treatment room is actually the TPI screen. So long story short, when I got out of school, I went for further education for golf, and it's called the TPI certification. So what it stands for is the Titleist Performance Institute. And essentially what they did is they basically screened golfers anywhere from, golfers as young as 8 or 9 years old up into the professional golfers in the PGA and the LIV. And they basically extrapolated a ton of different data and saw some of like the big lack of movement, so to speak, and just looked at a couple different things when golfers are kind of getting hurt, and basically gave stretches and exercises to basically try to not get hurt and improve your golf game. Jamie always likes to say, I guarantee to shave a couple strokes off. Results definitely vary because I don't know what you do on the putting green. So yes, you might be able to get a little bit more distance off the tee box, and you might feel a little bit better with, with your irons or wedges, but results vary due to putting. So so today I'm just going to kind of touch base, and then I'm actually going to grab someone from the audience to kind of show you what the assessment is for the TPI. And so basically the Titleist Performance Institute, they came up with a way to kind of assess like the 16 main biomechanical movements in a golf swing. And then it basically kind of gives you like a printout program on different stretches and exercises you could do pre and post round, just so you don't have an injury. And basically just to allow you to be a little bit more mobile in certain segments and a little bit more stable in certain segments in the golf swing. So I guess we will kind of just get on with the PowerPoint here. So the Titleist Performance Institute, they do not believe in one specific way to swing a golf club because everybody's different, right? So me, I'm 5'8", maybe waking up fresh off an inversion table. My swing is drastically different from someone who's 6 foot, 6'2", just because we have to create forces, and for a shorter guy, you kind of have to use the ground a little bit heavier, so to speak, to actually create a little bit more club head speed. So we could just go to one of the slides here, Phil. So yeah, just what we were talking about. So they studied thousands of golfers, and they just extrapolated a ton of different data, and they're basically trying to find, again, not there's not a perfect way to swing a club, but due to your physical makeup, whether you're a taller person, wider person, and if you had any kind of prior injuries, we try and basically find different ways that you could swing a golf club, what's most efficient for your body. So we go to we could go next one too. And yeah, so basically the TPI philosophy, what we were talking about, there's not a specific way to swing a club. Everybody's different. So we kind of go over the biomechanics, swing mechanics, movement quality, and then we kind of see if you had any kind of prior injuries or surgeries that's preventing you. So for example, how we basically give exercises and stretches for someone that had like a low back surgery, wrist surgery is going to be drastically different if you didn't have any of those. So we could kind of fast forward here. And we could go to, let's keep going. And yeah, so this slide is basically talking about, so the two big things is from the joints, literally working from the ground up, so from your ankle all the way up to your neck, you have joints that are meant to be stable and joints that are supposed to be mobile. So what we do is we basically give exercises to create stability, what joints are supposed to be stable, and then we give different kind of stretches and mobility drills, if you will, for the joints that are supposed to be mobile in the golf swing. So we could go next one. And so we were talking about what's supposed to be stable and what's supposed to be mobile. So that's kind of working from literally the foot all the way up to your neck. We could go to the next one. Let's go next one too. And we could kind of just keep it here. And then what I think I'm going to do is, just to kind of make this a little bit more interactive, I think I'm actually going to grab, if Zach's back there and if you could hear me, kind of just want to take him through and show you guys some of the screens that we do for the TPI, basically for the TPI screen. So I guess we will wait. Hey, Zach, you mind coming up here real quick? So we're just going to go through a couple. Again, it's basically the 16 main movements in a golf swing. But just for the sake of time today, I'm basically just going to take Zach through a couple different a couple different, maybe about four of them, and we're basically going to work from the ankle all the way up to the neck here. So Zach has been a patient of mine for probably 3 years now. So we already had the extensive health history, and you guys will see where he's a little bit limited due to a couple prior surgeries. And then we basically come up with a specific, basically just like a pre-round routine, just so he could get as mobile as he can in the injury that he had. So the first thing that we start with is the setup posture. So I'm gonna grab your club here. I'm lefty and you are righty. So I guess what you could do is you could kind of just like be side profile to the camera, and you could kind of just set up like how you're just gonna swing a 5-iron. So usually when we do these golf assessments, all you need is literally your 5-iron club, and we kind of just work around from that. So the first thing we do is we have the golfer actually set up in his normal, like if you're just going to hit a 5-iron. And the biggest thing that we're looking for is there's something called a C and an S posture. And so I'll kind of demonstrate in front of Zach here. So an S posture is if someone sets up and you kind of want to arch your back a little bit, like stick your butt out. So if we look at Zach, how he's set up, some people actually start with a little bit of an S posture, and then some people actually have a C posture too. So let's kind of like take your hips towards, yep. And so what we're looking for is like when we have the app here, the TPI app, so they're going to have setup posture, and then we're going to go into pelvic tilt and pelvic rotation. Zach, I'm just going to switch places with you real quick. So if anybody's having any pain in their low back when golfing, it's absolutely massive that we see their setup posture, because some people when they line up, they kind of just go Beyonce butt and push their butt all the way back, and you're absolutely loading the facet joints in your back, and I guarantee you your back's going to hurt towards the end of the round. And then vice versa. Some people when they set up, they're in a very, very big C posture, and that's going to load a little bit more of the disc in your back, and then you're going to create an injury in your low back. So we just kind of like to see at first how you set up. And then next, what we're going to do is, Zach, you're actually going to, you could put the club on the table there. And then so you could kind of just set up, and you're going to put your hands across your chest like this. And then we like to see his pelvic tilt to see if he could get into a C posture and out of a C posture. So you're basically going to stick your butt out, and then you're going to bring your hips towards the front of the wall here. And what we're looking for is, so it's kind of just like a standing pelvic tilt, just like this is going to be the motion here. And we're just going to see if he's able to do it. And there's something called a perturbation, which you got a little bit. I call it speed wobbles. It's you have like a little bit of shaking from going to the C to the S posture. Okay, and you can relax there. And so basically, I'll have to show you guys real quick right here. There's a program that TPI came out, and you input all this data. And what's really, really cool about it is based on your screen and your exam, it is very, very rare that anybody has like a ton of green lights, like 16 green lights. Even the PGA like professionals, I think there was actually one, I can't say the name, that actually had like a completely 100% score on the TPI protocol. Most people are going to have like red or a yellow. So like a yellow's you kind of set up right, and a red's like you failed. And again, we're just going to go through a couple of the motions here. And then what I want to do for you guys is, since the weather's getting nice and everybody's going to be golfing soon, give you some of the biggest things that you can do to kind of open up your hips and open up your mid back. Because a lot of times people will kind of lose posture, they'll sway, they'll slide due to a lack of mobility in your hips and thoracic rotation. So what we do is we basically click and we see the setup posture, and Zach was actually sitting in a neutral posture. In the pelvic tilt, I would say you couldn't flatten your back as good as you can. So we basically put all this data in, and then it spits out basically an algorithm of, you know, what was proficient, what was deficient, and then it basically gives you just like a set of basically exercises, stretches you can do pre and post round. So for the next one here, we'll just, since we kind of worked on the pelvis, we'll kind of go next to the shoulder. So this one's going to kind of be, it's called like a 90-90. So it's basically checking your shoulders. So what you're going to do is you're going to get it back up in your setup posture, and then arms going to go out to your side like this. Yep. And then what we're going to try and do is you're going to try and externally rotate your arm back while keeping your arm level. So I'm going to drop this here. Let's drop your chest towards the floor a little bit, and then let's try and take your wrist back as far as you can. And we're looking for him to get straight 90-90. If we could see Zach is just a little bit behind the 90-90, let's go back. And then let's go one more here. And this could be due to any kind of shoulder or lat thing going on. Okay, you can relax here. So what we would do is, in every single patient that comes in, we go through the 16 basically different protocols in the program. Usually when we have a patient in here, it's in a different room and it takes about an hour. But again, we're just going to kind of go quick, just so you guys could see like some of the different movements that we do. Save this in here. Okay, and then lat test is going to be kind of hard. We will do the lower quarter rotation. So I just wanted to show you guys just a couple of them. The next, we're actually going to check the hip mobility. Actually, I think I could demo this one. So for the hip mobility, usually what we'll have patients do is you're going to stand and you're going to go on toes, hands on your hips, and we're going to turn into a hip. And then we basically draw out with different measurements on the ground to see if you could kind of turn your hips fully into internal rotation. And if you're having problems with that, there's different stretches and exercises we could do there. And then we kind of do vice versa. We go into external rotation. And then that was basically kind of like for the hips. Basically, we have like a lower quarter rotation, seated trunk rotation. We're checking glute function. Again, this would probably take like an hour and a half with a golfer. So I just wanted to show like a couple. And then the big thing is I kind of want to basically just get on the table and show you like what we found over treating a ton of patients during this. The most common lack of mobility regions are definitely going to be in the hips, and they're actually going to be in the thoracic spine. So what I think I might do is I think I might sit down and kind of just do some of the stretches and the exercises, and then maybe I'll work with Phil and see if we could actually just carve out some time in the next couple weeks and then like actually take you through the full protocol. And then hopefully we can kind of put that online for you guys so you can see what is going on. So I think we'll kind of just jump into it. Thank you, Zach. I appreciate it. I think this will be all right. Yeah. So we'll kind of start basically from the ground up, and we will actually start with what's very, very common, and that is going to be something called upper cross and lower cross syndrome. So can we change slide to the upper cross? Unfortunately, in our society, all we do is sit. And when you sit, basically what happens is your deep neck flexors kind of turn off. Your upper traps gets very, very tight. Suboccipitals get tight. Pec minors get tight. And basically your serratus anterior, they kind of turn off as well. So this is one of the biggest things that basically leads to a lot of just bad, faulty biomechanical movements in the golf swing. So I could kind of show you just real quick what we could do to kind of fix the upper cross syndrome. Again, everything we do, whether it's driving, eating, sitting on your phone, everything we do is in the flex society. So neck kind of wants to go forward, head wants to go forward, and the deep neck flexors turn off. So one of the easiest things that you could do to kind of get rid of some of the residual tightness, if you will, in your upper traps, very, very easy if you're at home. You're basically going to take, if we're working on your right side, you're going to take a right ear to a shoulder, 2 strong fingers, push on your upper trap, and then you're going to slowly go to the left side. Pop off and release. Most people, I would say 99 out of 100, usually hold all their tension in their upper traps and their suboccipital muscles. So if I have a golfer that they fail on the cervical rotation. So how we check that in the golf assessment is we basically ask the golfer to take their chin as far as they can, and then you're going to try and drop it down and see if you could touch your chin to your clavicle here. If you can't, there's different stretches and exercises we'll give you, because if you don't have the cervical rotation, when you're going through your backswing, instead of keeping your head down looking at the ball, your head's going to kind of want to come up, and then you lose posture, early extend, and then you're just going to totally screw up your golf swing, and then you're probably going to have an injury due to that as well, depending on how frequent you golf. I guess I should say, disclaimer, I am not a golf pro. However, I definitely do like to kind of see how your body moves to see if we could make you a little bit more mobile and a little bit more stable. And again, my goal is, and I love when people come in after treating them a handful of times and giving them things to do before they go hit the range. I love when someone comes in and they're like, you know what, I get through like 12 or 13 holes and then my back starts killing me or my elbow starts killing me. I love after a handful of treatments, they come in, they're like, I played 18, I felt great. And then I actually felt so good on Saturday, I went out and played another 9 on Sunday. So That's what tickles me, just basically getting people out there and playing pain free. And then love to give a different kinds of exercises that you could do at home, just so you can. So if you're having trouble taking your club all the way back, you're kind of losing your posture. I love gunning, and we'll go over some of the mid back mobility, thoracic rotation, if you will, just so you could kind of swing the club freely how you want to. So getting back to the upper cross syndrome, what happens? Those deep neck flexors turn off. So one of the easiest things that you could start doing is think of someone really ugly trying to come kiss you, and you're just going to kind of make a double chin away. And so this is a good way to kind of work on some of the extension, so your head's not stooped over like this, and we're going to get you a little bit more upright. So this is called a chin retraction. And this is one way to do it, and probably the more advanced and the more beneficial way to do it is actually laying on a table. So you're going to be laying on a table, and arms are going to kind of be out to the side like this. It's going to be kind of hard with the microphone, but we should be all right. Yeah, if you don't mind. And so what you could do for an advanced, basically to kind of turn on the deep neck flexors is you're going to be down in a posture like this, and then you're going to work on basically just taking your chin up, and you're going to kind of fight gravity this way. And so this is just another way to kind of increase the strength of the deep neck flexors, because everything we do basically turns them off in society. So that is one for the deep neck flexors. And then you want to go to the next slide here. Okay, and yeah. So this is probably one of the biggest things we see, especially, not only in the golf world, just everyday population and life and everything. So lower cross syndrome. I'm going to show you basically different ways to kind of get out of this. This is the classic when you see people walking around with, I call it the Beyonce butt. Basically what happens is your core, like your abdominal muscles get way laxed. Glute max gets weak. And then what happens is you get, it says on the screen here, tight thoracolumbar extensors. So the main stability muscles in your back, those get crazy tight. And then you get crazy tight in your hip flexors as well. And I will show you how to kind of not only stretch the hip flexors, but if you're going to stretch, for the most part, you actually want to strengthen as well. So if we were talking about lower cross syndrome, to basically stimulate your abdominal, your core muscles, some of my favorite, the big three that I like is something called a dead bug, a bird dog, and a Pallof press. And so we'll touch base on those. So I will show you guys how to do the dead bug here. And the dead bug looks how it sounds. So you're basically going to be, I think we'll be all right here, laying on your back here just like this, and then you are going to pick your legs up at 90-90, and then I'll just demo with my one arm here. Both arms will kind of be up like this. The biggest thing when people do the dead bug is when they kind of set... The biggest thing that happens when people kind of set up for the dead bug is they have a huge, basically gap in their back. So like their low back's off the table. One of the biggest things you want to do is you want to actually deep breath in through your belly. And you kind of want to think about taking your belt towards the sky, because you want your back to be flat on the ground. So I can't emphasize that enough. If you have a huge gap in your back, you're not going to be doing it correctly. So we want back to be as flat as it can on the floor. And then the first progression is you're basically just going to be taking heel down, touching the table, and coming back up. Very, very simple. Most of you guys will blow this out of the water. So to make it just a little bit harder, then we're going to basically go straight leg all the way down and then all the way back up. And this is just... I'm gonna hit the table. This is just a simple dead bug. And then what we do is then we start to get the upper extremity into it as well. So when we get the upper extremity into it, opposites get big. It's kind of like patting your head, rubbing your belly. It takes a little bit to get used to. So my right arm is gonna go down, and my left arm is gonna go, or my left leg's gonna go down. And the slower you go, the more you're basically gonna stimulate your abdominal core muscles. And then we would go vice versa. So then we would go right leg gets big, left arm gets big, all the way down, and then coming all the way up. And so that is basically the dead bug progression. If you really want to make it if you guys blow that out of the water, if you want to make it a little bit more challenging, I got an exercise ball behind me. What you could do is you could kind of pin the exercise ball with the knee that's not moving and the arm that's not moving. And that is basically just going to light your core up. And again, can't stress this enough. A lot of people have very, very not strong core muscles at all, and this is absolutely massive. Not only in the golf game, but anybody at home that's kind of experiencing any kind of low back pain. And then for the wheat glute max muscle, one of the easiest things that you could do is basically just like a glute bridge. And so you're going to get up and hold for a second or two, and then straight back down. So I would suggest people at home just to kind of work on this motion at first here. And then once you get proficient for holding for a couple seconds, you could actually kind of hold this for 30 seconds. And you want to feel this in your glutes. You do not want to feel this in your hamstring. And then the progression for that one is, and again, these are like the most basic things you could do at home. It's a lot easier if you come in and are a patient, because we could take you in another room and show you like very advanced stuff, but I just want to kind of keep it basic for today. And the progression from that is you're going to do your glute bridge, and then you're actually going to take a leg up and kind of hold it straight, and this is going to really fire your glute. And I would suggest when you're doing these, hold for anywhere from 15 to 30 seconds, and then come back down. If you do those glute bridges with the leg up and you start to experience any kind of cramp in your hamstring, I would say come in and we could kind of give you even like a couple easier ones to do before that. But that's like the biggest ways that you could kind of help with your core stability muscles and your glute max muscle. Another one that I really like is called a bird dog. So a bird dog is kind of like inverse of, I guess a bird dog's kind of like, can you hold this for me? It's kind of like the inverse of the dead bug here. So a bird dog is you're going to be on all fours, and same thing. Opposites get bigger. So it's going to be right leg and left arm go out, and then you kind of hit right there, and then come back down. And again, the slower you do these movements, the harder they are. But these are like the top. I mean, I'm going to give you guys like the top 3 core stability muscles, core stability exercises. Thank you, Phil. And what's big about these is, like, when you're doing these exercises, a lot of people, when they think they want to exercise their core and they want to get ripped and get the abs, right? You'll see people at the gym doing like windshield wipers for your abs. You'll see them doing like Romanian chair sit-ups and everything. The biggest thing about the dead bug, the bird dog, and the Pavlov press, which I'll show you guys in a little bit, is you're basically training your core with your spine in a neutral position. I think most people end up tweaking their back when they're exercising, because when you're doing all these crazy kind of sit-ups, let's just face it, your abdominal, like your core stability muscles, they're basically stability muscles of your spine. So you want to train with the spine in a neutral position, just because that's not only going to help with the golf swing, but that's just going to help overall with any kind of low back pain. And then lastly, so the tight hip flexors. This has been all over the internet, on TikTok, YouTube, Instagram. Everybody's talking about an iliopsoas muscle. And so what is the iliopsoas muscle? An iliopsoas muscle is actually a muscle that attaches to the lumbar vertebra in your back, actually traverses through the front of your body, and it attaches to the front of your hip. So very, very common. Anybody that's had chronic low back pain, like they feel good for a couple months, then it tweaks again, good for a couple months and tweaks, you probably have a crazy tight hip flexor, that iliopsoas muscle. The reason why, all we do is sit. And so when we're in the seated position, it basically just puts a ton of tension on that iliopsoas muscle. So the best way to stretch it is, we'll show you right here. And so if you get on the internet, when you're stretching this muscle, everybody always just says you're going to start like this and kind of move forward. Yes, you'll feel a little bit, but if you want to do this correctly, when everybody starts, I keep saying Beyonce butt, everybody has the Beyonce butt, so their butt's kind of poked out. So to make this just work like efficient as possible, you're literally just going to think of taking your belt towards the wall in front of you and just basically stacking your pelvis under your rib cage. And as soon as you stack your pelvis under your rib cage, you're going to feel a nice pull in the front, and then you could lean forward. That's definitely the most efficient way to kind of hit that iliopsoas muscle. So I would suggest at first, if you're at home trying to do this before you go golf, or if you just feel tightness in the front of your hip, I would suggest just basically stacking your pelvis under your rib cage and kind of just holding isolated for like 10 seconds. And you'll feel the stretching like crazy in the front. Relax. And then for the next one, stacking pelvis under rib cage, and then you can move forward a little bit. And if you really want to emphasize it and make it as hard as you can, you're going to go arm up and kind of lean away, and you're going to feel that all through that iliopsoas muscle. So if we're going to stretch it, we definitely have to strengthen it too. My favorite way to strengthen it is if anybody has a kettlebell at home, what you could do is with a kettlebell, or if you're at the gym, if you have any kind of resistance bands, you're basically just going to work on putting your foot through the kettlebell, firing up, and then slowly lowering for 4 seconds. That's an eccentric load, and that's going to be one of the best ways to strengthen it. If you don't go to the gym, if you don't have kettlebells, if you don't have resistance bands, very, very simple. What you could do at home too is basically just sitting in the middle of your floor. And I like to tell patients to get water bottles and kind of just put them in front of you on the floor, just like arms on the clock. And what you're going to do is you're going to try and sit up as good as you can posture-wise, and you're literally just going to be picking leg up and then going over the water bottles. And that is going to basically start to strengthen that iliopsoas muscle. And again, if you have like chronic low back pain that kind of gets better, gets worse, gets better. If you start to stretch and strengthen this iliopsoas muscle, can't make any guarantees, but I feel pretty confident that it's actually going to help with your low back pretty good too. So, and then I guess that covers lower cross. And then lastly, the biggest things that we see in golfers is basically a lack of rotation and basically a lack of range of motion in the hip. So I'm going to show you guys my favorite thing for external rotation of the hip and internal rotation. So I'm a left-handed golfer. So when I go through my backswing, what's going on is my left hip is going into internal rotation and my right hip is going into external rotation. So what I like to do is, depending on if you're right or left-handed, we'll kind of work on what you need to go through the golf swing. So the first one that I like to do is it's called a 90-90 sit. So you're going to be on the ground, and front leg is going to be 90-90, back leg is going to be 90-90. And basically what I just instruct the patient is at first, if you're having tightness in your hips, like if you're losing your posture during the golf swing, basically what you're going to do is you're just going to basically take your chin or your chest all the way down to your knee. And you could hold. Now, if this is too hard, like if you can't get your foot 90-90 and it's hurting, you could kind of cheat and take your heel into your groin a little bit, and then you're going to lean down as far as you can. And then I like to tell patients to kind of like go around the world, so to speak. So instead of just kind of going in this straight plane of motion, I'll kind of tell them just to kind of oscillate down into it, because if you go outside the knee and if you go inside the knee, you're going to kind of feel it stretch in different places of your hips. A lot of people are highly immobile in their hips, and that leads to a lot of strain on your low back when you're actually swinging a golf club. And again, anybody at home that's having any kind of low back pain, usually you're not as mobile as you should be through your hips. So that is one of my favorite ones for the external rotation of the hips, for the stretch. And then if you want to basically if you want to do the exercise to kind of strengthen it, it's just basically, switch here. It's just basically called like a 90-90 get up. And so you're going to be in this 90-90 position, and then you are basically just going to try and raise up. And this is, again, we did the stretch, and now we're going to do the exercise to kind of strengthen. Again, can't emphasize that enough. If you're going to stretch something, you definitely want to strengthen it too. So that is going to be for the external rotation. For the internal rotation, this one's a little bit trickier. You're still going to be in the 90-90 position. Yeah, table's a little small. So when you're in this 90-90 internal rotation of your hip, this is a hard one to kind of basically just like increase the range of motion, so to speak. So if this is too hard, I'll show you the regression first. So with you in the 90-90 position, what you're going to do is the back leg, it's very, very simple. You're just going to literally try and pick your foot off the table and put back down. Now, if you're doing this, or if you're having any problems just trying to get this leg off, you could kind of do an easier progression. So you could kind of be laying on your belly here, leg's going to be out, and then you're just going to pick up like this. So this is probably the simplest way to do it. I guess probably the simplest way to do it. If that's even problematic for you too, you could basically just be seated, and you're going to be working on taking your leg out from the side of you. So that's going to be working on internal rotation of your hip. A lot of times when we take people through the golf screen, the golfers, they are basically getting all out of their club path because they're lacking the internal rotation of their hips. So again, this is probably going to be, you could even do this before you go out and play too. This is the simplest way to get internal rotation. And then I would say intermediate is going to be laying like this, leg up, and then slowly down. And then lastly is going to be in that 90-90 position. And then you're just going to be trying to pick your leg up off the table. And so that is basically for the internal rotation and external rotation of the hip. A huge thing in golf too is thoracic mobility. So if you cannot move your mid back, efficiently, you're going to have a ton of problems in your golf gang and probably in life too. So one of my favorite ways, I'll just give you a couple of my favorite exercises for thoracic mobility. The first one, we'll start low and then we'll kind of work our way up. So the first one's called an open book, and it's very, very simple. And if anybody kind of feels locked up in their mid back, you could do this at home too. So an open book, you're basically laying on your side, and I would have my left hand basically just resting. I would have my left hand resting on my top leg right here, and it's very, very simple. You're literally just opening the book, and then you're going to go back. And this is probably the easiest one to do for thoracic rotation. And I tell patients at home, once you feel efficient doing this, you could take your arm as far back as you can, and you could kind of just hang out in this position, and this will kind of just unlock your mid back here. And so that is called an open book. One of the other ones that I like is called a thread the needle. So if you guys go to the gym, you could basically grab a pulley from the side. If not, you could get a resistance band and tie it to like the leg of a kitchen table. And a thread the needle here is, can you hold this for me? Sorry, Phil. So a thread the needle. This is actually a really good one before you go play too. Is you're going to be on hands and knees. You're going to take your arm and you're going to thread the needle, and then you're going to drop shoulder towards the ground, and then you're going to come back. And so it's, I think you get a little bit more bang for your buck if you have a pulley system at the gym. Don't do anything crazy weight. You only need 5 to 7.5 pounds. Or if you have a resistance band, you don't need a ton of tension on the resistance band, but you're literally going to take your arm and then you're just going to drop, and this is going to kind of help open up your mid back. Patients love that one, the thread the needle. You just get a lot of bang for your buck for that. And then the next one, the TPI, that's going to be kind of hard just because I don't have a wall, but this is actually probably my favorite way to kind of open up your mid back. If this was a wall right here, what we're going to do is the leg that's closest to the wall, you're going to be down on a knee. And then the opposite knee, the closer it is to the wall, the harder it is to do. So I advise patients at first, start with like a foam roller or a paper towel roll, and you're basically going to try and pin it up to the wall. So if you have your paper towel roll, you're going to be pinning it against the wall, and then both arms are going to be out in front like this, and then you're just going to do a rotation and try and touch back your hand to the wall here. And so this is probably one of the most efficient ways to kind of open up your back, especially if you're going to go golf. Again, the bigger the object, the easier it is. So I tell patients at first, start with like a paper towel roll, pin it up, and if you start blowing that out of the water and the better you get at it, maybe go with like a Lysol wipe container. It's a little bit smaller, and then you could kind of just keep working this leg closer and closer, and that's just going to make it harder and harder to kind of get your backhand all the way to the wall. But that is a fantastic way to kind of open up your thoracic spine before you go swing a golf club. So that's probably one of my favorite ones there. And lastly, if people are struggling with thoracic extension. So if you see a lot of people walking like stooped over like this and they're not like erect, like standing straight up, what you could do for this one is very, very simple. Coffee table at home or a bench at the gym. You're going to go elbows. I'm going to try this. Yeah, sorry, Phil. For this one, basically you're going to go on your knees, elbows, and then you're basically just going to work on kind of dropping the upper part of your chest all the way down to the ground. And this is just for this to be perfect, this table would actually be a little bit smaller, but you're basically just working on kind of sinking your butt back and basically just getting some extension into your mid back here. And this is a good stretch because, again, everybody in our society is just in a stoop posture just from driving, eating, watching TV and everything. So that's just a good one. Yeah. So in a perfect world, this table would be a little bit lower. This is kind of high. But you're going to be on your knees, hands. You could kind of keep them out or you could put them in. This is a little bit easier. And you're just going to basically work on dropping your chest towards the ground here. Good? Okay. Yeah, I mean, because not a problem. Yeah, because honestly, everybody is always in a flex posture. It's just nice to get a little bit of extension. I call it the yin with the yang. And then lastly, very, very common in golfers that, that at least I see in this clinic is, has anybody ever heard of like golfer's elbow or tennis elbow? So yeah, long story short, tennis elbow, how I remember it in school was tennis balls kind of have like hair on it. So that's the outside of your elbow. Golfer's elbow, golf ball smooth, and that's going to be on the inside. So they call that lateral epicondylitis and medial epicondylitis. What I think is kind of funny is I think more people who golf actually have lateral epicondylitis, which is tennis elbow, as opposed to golfer's elbow, which is medial epicondylitis. But I'll just show you like some of my favorite ways to kind of treat if you're having any kind of outside elbow pain. So long story short, if you're having pain like on the outside of your elbow when you're golfing, it is usually due to like an overuse injury of your forearm muscles. So you have a ton of muscles that run right here. The main culprit is a muscle called your extensor carpi ulnaris brevis. Why they can't just call it a forearm muscle beats me. But that's usually the main player in any kind of lateral epicondylitis. So what I like to tell patients what you could do at home if you're having any kind of lateral elbow pain. The first thing that you could do is manual therapy at home. So usually what I'll tell people to do is you're basically going to start with your palm facing down, and then you're going to grab two strong fingers. You're going to push where you're having pain in that muscle, and then you're going to rotate palm up and pop off. I do this to patients in the room, and yeah, you feel it when we do it, especially if you have a couple trigger points. It looks a lot different when I'm actually performing it on you, and maybe we'll have to get a video out that we could post just so I could show you how to do it. It's kind of hard with the microphone too, but that's one of the main ways that you could kind of just loosen up. And then the rehab exercise for it is called like an eccentric range of motion. So what you're going to do is at home, you're just going to grab nothing more than 5 pounds. You're just going to get like a 2 or 3 pound dumbbell, and you're basically just going to rest. And then you're going to do a wrist extension up in 1 second, and then you're going to slowly lower for 4 seconds. Eccentric loading is the best way to kind of beat any kind of tendonitis or tendinopathy. Kind of going off subject here, but tendinopathy. So basically, what is a tendon? What is a ligament? What is a muscle? Tendons. A lot of people, very, very common, training for the half marathon right now. They say they have Achilles tendonitis, and they're like, well, what can I do to make that better? I've been foam rolling, I've been stretching, kind of helps, but it usually reoccurs. The reason is tendons actually have a fixated length. They actually don't really stretch. They don't like to be stretched. So if you have any kind of tendonitis or tendinopathy, the main thing you have to do is actually kind of load it. So like if anybody struggle with any kind of Achilles tendonitis at home, usually I'll have them go on on a step and say it is my left Achilles. What we'll have patients do is you're going to do a calf raise up, pop your left up, and then slowly lower for 4 seconds, because your tendinopathy is not going to get better. It might feel better temporarily if you foam roll it and do some kind of manual therapy at home, but you have to load it. So that's usually what I'll give them at first, and then I'll actually have them in a seated position with a kettlebell or a weight, and then they'll do the same thing, pop up, and then slowly lower for 4, and then we kind of progress to them actually holding the weight on a stair at home, and then they'll be doing that as well. So what I like to do for the tennis elbow, same thing. You're going to grab a dumbbell. You're going to fire up in 1 second, slowly lower for 4. And then I also tell patients if you have a hammer at home, grab just like a normal hammer, and then you're basically going to let the hammer fall, and then you're going to slowly lower up for 4 seconds. So that's going to be like the best way to kind of help with any kind of like tendinopathy. It's nice to treat it at home, but also we got a couple like really nice bells and whistles and tools here that kind of expedites the process. So like if you're a patient, we have a therapeutic laser, which really helps. I do cupping therapy, grass, and all that kind of jazz. So that really expedites the process. But if anybody has any questions on like, hey, I tweaked my elbow, or I tweaked my knee, tweaked my Achilles. I always tell patients like, I like seeing you, but I would like to see you at like Giant Eagle or a concert. I'm not one of those chiropractors that's like, you need to come in 3 times a week for a month, twice a week for the next month. Usually in like 4 to 6 visits, people feel a ton better. So I'm a huge fan of like home exercises and care too. So usually I'll tell patients, look, you're probably going to feel a lot of symptomatic relief in 4 to 6 visits, but here's the different stretches and exercises that you could do at home to prevent this from coming back. Did I ramble on long enough? Yeah, okay. Yeah. So, yeah, today we wanted to kind of do the talk about golf. I absolutely love golf. I love treating people in the room, but honestly, I have a ton of fun. Any golfer, whether you're hurt or you kind of just want to feel a little bit better swinging a club outside, I love kind of just like basically like picking apart different joints in your body if they move well enough, if they don't move well enough, and then basically giving different things that you could do pre-round and post-round just to again, hopefully you're not in pain golfing, just to basically increase increase your game, just make you as optimal as you can. Again, results vary because I don't know what you do on the green putting. So thanks guys for sticking tuned here. And next we got Dr. Len at 12. He's going to be talking about gut, correct? And then we got Alicia at 1. And then Alicia is going to be weight loss at 1. So thanks, guys. Welcome to Wellness Week 106, and talk to you guys soon.